Hi friends, I am a senior orthopedic consultant and I head the orthopedic department at Sun Permanent Hospital, Delhi. Now, this is a program called Elite, which is basically a patient awareness program for the general health. So today we'll be discussing about the importance of musculoskeletal health in general well-being of a person. Now, many people ask me that for a normal person, the lungs are important, the heart is important. What's the role of musculoskeletal health? Well, if you ask me, then I think it's perhaps one of the most important organ of the body. It is the largest organ of the body. If you consider the muscles, bones, if you consider all this together, it is almost the largest organ of the body. And it plays a very key role to keep up the good mobility and dexterity in an individual. So, along with enhancing their ability to work and actively participate in all aspects of life, it is also helpful to maintain the economic, social, and the functional independence across the life course. So, mobility, as we understand, is very important for a person, and in that aspect, the musculoskeletal health is plays a very important role. And if we consider today's time, the non-communicable diseases, that means non-infective diseases, are becoming more and more. So, this musculoskeletal health or this physical activity, they play a very important role in decreasing the risk of these non-communicable diseases. So, it's very important that you maintain a very good musculoskeletal health. Now, when we talk of musculoskeletal health, what does it mean? It usually means that your bones and your muscles are working well so that you can walk better, you can run, you can do exercises, you can work with your arms, and you can perform your day-to-day activities in a much better. Then comes the question that how does the reduced capacity of musculoskeletal health is harmful for a person? Impaired musculoskeletal health can lead to acute and chronic pain. Now, suppose you get injured in an accident or during play, then it can lead to acute pain. But if you are suffering from arthritis, it leads to chronic pain. Both of this condition, they cause physical limitation, they cause loss of participation in day-to-day activities. This can lead to withdrawal from social activity. Person, if he's suffering from arthritis, they usually try to avoid going to any social function or any outdoor activities. So in general, it also affects the quality of life and affects the mental well-being of a person. So in that respect, to remain active, it's very important that your musculoskeletal health is an individual who is having arthritis or musculoskeletal disorder is sure to be lesser active than an individual without arthritis. A lack of regular physical activity has emerged as the most prevalent risk factor associated with functional decline. Now, it has also been found that poor musculoskeletal health, it causes reduced physical capability like grip strength, walking ability, chair rising, standing balance, and it has been frequently linked to increased mortality also. So, to maintain good musculoskeletal health is very important. The impact of impaired musculoskeletal health is now recognized globally with an increase in morbidity and mortality related to it. Now, it is very crucial to maintain an active, productive, and prolonged working life. So now we see that people are living longer. There is increase in global retirement age. So maintaining good musculoskeletal health will become increasingly important for older workers as many occupation and work-related activities are associated with musculoskeletal problem. Now, especially if we see today's time, now because of the COVID, work from home has increased a lot. Now, this has also led to many problems associated with it, and most of the problems are musculoskeletal problem. We see a lot of patients who are having this neck pain and shoulder pain because they have to constantly sit in front of a monitor. At home, they cannot have ergonomically proper desk or chair, so that has led to increase in stress on the neck and shoulder muscles. Similarly, prolonged standing has led to increase in back pain conditions. Obesity has increased because they are not getting proper exercises, they are not moving out. All of this has led to physical impairment and many such problems such as hypertension, mental problems have also cropped up because of this poor musculoskeletal health. So that's why it's very important to maintain a proper musculoskeletal health, because many other conditions are also associated with it. Now, people ask that is it really that important? Is it really that common? No. If you see the literature, if you see the data, then non-communicable diseases. Now, previously, people used to worry about typhoid, malaria, and other infective conditions, tuberculosis. But now, better and better antibiotics are available. So, these communicable diseases or infective diseases, the burden of these diseases are going down. What has now increased are the lifestyle problems. The lifestyle problems, which includes diabetes, hypertension, arthritis, obesity. So all these problems are increasing. So if we talk of non-communicable diseases, then musculoskeletal problems have a very, very major part of these non-communicable problems. Now, in developed countries, the population is aging. Okay, the number of aged persons are quite more, and these problems are more. But if we talk of developing countries like India and other developing countries, there also we are seeing that percentage of older people are increasing. So all these problems, the arthritis, back pain problem, and all these musculoskeletal conditions are increasing, and in coming times the burden of these diseases are going to become much, much more. Now, is there any role of physical inactivity and sedentary behavior in development of these problems? A very, very close association is there. What we have seen that because of sustained and systemic urbanization in developed countries has led to sedentary behavior among the people, particularly the young ones. Nowadays, if we see our children and other young people, instead of going out and playing in the field, they prefer just sitting at home and playing video games. Now, earlier we used to play video game alone, but now what has happened that because of all this internet connectivity and newer technology available, they are able to play with their friends on internet. So we see them just not going out, sitting at home, sitting for long duration in uncomfortable position. We also see people watching TV. Binge watching has now become a very favorite word, and people are just trying to finish the program in one night only. So all this has led to increase in back pain and neck pain. So all these problems are because of this sedentary lifestyle, which is probably a consequence of this modern lifestyle. Secondly, what has happened that the nutrition has also uh, been affected in these times. There is more consumption of refined food, more consumption of sugar, and all that has led to poor nutrition. There is lack of micronutrients, and this has led to obesity. So the combination of sedentary lifestyle as well as obesity has led to all these problems. The obesity has led to increased stresses on your knee joint, on your back, and this has affected the productivity of the person. So physical activity is very essential. Increase physical activity and optimizing exercises are recommended by arthritis research and WHO. It has shown that even if you do small exercises, even 20 minutes of exercises per day can lead to decrease in cardiac events, and it also improves and strengthens your bones and muscles. Doing physical activity is very, very important. You need to go out, you need to go into the sunshine. It's a paradox that in our country where there is abundance of sunshine, there also people suffer from vitamin D deficiency. It's because of our lifestyle. We want to stay indoors only. So that has led to all this kind of problem. Now, the WHO, it recommends 20 minutes of exercise per day, like brisk walking. These exercises, they elevate the heart rate, and they also known to be associated with lower lifetime risk of cardiovascular event. If we see, particularly like my field is management of knee arthritis and all that. Now, if we see that, we have found that the number of patients suffering from knee pain has increased tremendously. I would say almost 20 to 30% of my OPDs are filled with patients who have knee pain. Now, if we see the cause of knee pain, now some of them is not under your control, like a genetic factor. If your parents are suffering from knee pain, then there is slight increased chance that you may also suffer from knee pain. Many other factors which are modifiable, that means which are environmental factor which you can control. One of them is obesity, one of them is doing proper exercises, one of them is having proper nutrition. So if you can avoid obesity, then there is less stress on your knee joint. So the development of arthritis is slowed down, or the symptoms because of it are also decreased. Similarly, if your nutrition is proper, if your protein and calcium content is adequate in your diet, then also it helps your bones and joints, and the chances of progression of arthritis is low. And most important is exercises. If you do exercise properly, which includes strengthening as well as stretching exercises, then it greatly helps in decreasing the development of arthritis. Or if you're suffering from arthritis, then the symptoms can be managed. So that is very essential. So as we know that aging is inescapable. Okay, everyone ages, and along with that, degenerative changes are bound to come. But if you do this, if you follow these simple things, if you go out, do some brisk walking, if your nutrition is proper, if you avoid junk food, if you avoid refined food and sugar, do proper exercises, improve your muscle mass, then it has shown to improve the quality of life even in elderly person, not only in young person. If at a age of if at young age you do this exercise, then it will prevent arthritis. If at older age you do, then also it reduces the symptoms because of arthritis by improving the muscle mass. Exercises and mechanical loading also have a positive impact at the molecular, cellular, and the tissue level. So the potential for cell proliferation and number of stem cells, they decrease in tendons because of aging. But if you do exercises and loading, it can induce an increase in tendon collagen synthesis, thus increasing the tendon length, tendon strength. So they have a very positive role in maintaining the cartilage and bone health. The moderate exercise also enhances the quality of tissue produced during the healing of the injured tendon. So it's very important that you do exercises. Obesity, as we discussed, is the mother of many problems. It can cause arthritis, it can cause hypertension, and combination of obesity with other problems can also lead to cardiac problems. So it's very important that you control your diet, you do proper exercises, and you keep your BMI within normal limits. So exercises and weight loss, they have benefited overweight and obese adults with knee arthritis in many clinical trials. Even modest weight loss with moderate exercise can provide a very good overall improvement in symptoms of pain and childhood function and joint function. Diet is a very important part for healthy living. It has been shown that if the diets which are rich in potassium from fruits and vegetable intake, they reduce the amount of muscle loss in adults who are more than 65 years of age. Similarly, dietary flavonoid intake from fruits and vegetable is also known to be positively correlated with good bone health in perimenopausal women. So, improvement of diet in osteoarthritic patients have shown great benefit. Vitamin D, calcium, and protein, which are usually lacking in Indian diet, they have to be supplemented. And if you take your diet, which is rich in calcium and protein, then it improves your overall musculoskeletal health, and in general also it improves your health. So these are few things which have to be kept in mind. Musculoskeletal health, proper musculoskeletal health is very important for overall functioning of your body, for doing your day-to-day activities, for recreation, for your occupation. It's important for everything. And that is also related to maintenance of general health, because if your musculoskeletal health is poor, then you can't do any physical exercise. So indirectly, it affects all body function. And this can be maintained. A good musculoskeletal health can be maintained only with exercises, some moderate exercises, proper nutrition, a diet which is rich in calcium, which is rich in micronutrients, fibers, and protein, and prevention of obesity. Thank you. Thank you very much.